Welcome to The Explainer. Today, we're going to unpack a literal corporate thriller. We're taking a close look at what is widely considered the greatest distress buy in Indian pharmaceutical history. You see, in the highly regulated world of pharma, a distressed asset usually means toxic FDA hurdles that most buyers won't even go near. But today, we're going to walk through the dramatic rise, the catastrophic fall, and the absolutely brilliant acquisition of Ranbaxy by Sun Pharma. Guys, this is a masterclass in seeing massive value where everyone else only sees disaster.
To really understand the sheer scale of the crisis we're talking about, just wrap your head around this number: $1 billion. That is the staggering amount of market value that Ranbaxy bled in a single week. Now, this wasn't a slow, gradual decline, right? It was outright panic selling by institutional investors who were absolutely terrified of a total U.S. market lockout. And this catastrophic drop was triggered by a major FDA ban that basically brought the company to its absolute knees.
And it wasn't just FDA bans either. The situation escalated to historic, unprecedented legal consequences, culminating in a massive statement from the Department of Justice regarding a $500 million settlement for 7 felonies. These weren't just minor little infractions. They involved systemic data fabrication and adulteration. It perfectly explains why the DOJ had to step in right alongside the FDA, resulting in what was the largest generic drug settlement in U.S. history at the time. Okay, let's dive into this, because understanding how this massive corporate disaster unfolded is really the only way to understand how it became the perfect setup for an absolute pharmaceutical heist.
Phase 1. The Mark.
So, back between 1961 and 2004, Ranbaxy was the Indian pharma poster boy. They were the very first Indian pharma company to cross $1 billion in sales. They built this massive U.S. business, pulling in 40% of their revenue just from U.S. generics. And they were super famous for these first-to-file wins on cheap copies of blockbuster drugs like Lipitor. That status is incredibly lucrative because it grants 180 days of exclusive market rights. But that hyper-growth was built on cutting corners in manufacturing documentation. Fast forward to June 2008, the Japanese giant Daiichi Sankyo buys a 63.4% stake for $4.6 billion. They thought they were getting a total bargain on a global platform. But because of hidden data integrity issues, this would go down as the absolute worst pharma deal in Japanese history.
Which brings us to Phase 2, the FDA death spiral.
Just look at the sheer speed of this collapse. In 2012, Ranbaxy signs a consent decree. And a consent decree isn't just a slap on the wrist. It's a legally binding agreement forcing incredibly expensive third-party oversight of their plants. And all of this is happening while they're dealing with recalls for literal glass particles in drugs. Then, May 2013, the hammer drops, that $500 million fine for selling adulterated drugs and falsifying data. By September 2013, the FDA outright bans their brand new Mohali plant, which was supposed to be their big savior. And the final nail hits in January 2014 when the Toyanza API plant in Punjab is banned. Now, API stands for active pharmaceutical ingredients. The FDA didn't just ban the finished pills, they banned the raw materials used to make them. They effectively choked the entire supply chain. And with that, Ranbaxy lost all 4 of its Indian plants that exported to the US.
The fallout? Absolute devastation. The stock plummeted nearly 60% from its 2008 peak. Daiichi Sankyo was forced to write off $3.5 billion. And as we were talking about earlier, the company was hemorrhaging $1 billion in lost market value just during the week of the Mohali ban alone. Ranbaxy was at rock bottom. But in the high-stakes world of distressed acquisitions, rock bottom is exactly when the right buyer steps into the picture.
Phase 3, the Masterclass acquisition deal.
April 6, 2014, Dilip Shanghvi, the founder of Sun Pharma, announces the deal. And the immediate reaction? Well, the market absolutely hated it. Analysts were publicly calling the move crazy, warning that it could heavily dilute Sun's quality. You see, Sun Pharma traded at a premium specifically because of its pristine FDA compliance record. So absorbing a toxic, heavily penalized asset like Ranbaxy, it seemed financially reckless. And Sun's own stock actually fell 5% right on the announcement. But what the market completely forgot was that Shanghvi had done this exact thing before. He had successfully bought distressed U.S. generic makers like Hiraco in 2009 and Taro in 2010 and turned them completely around. Taro alone had more than doubled Sun's U.S. revenue.
So the crucial point here is exactly how this deal was structured.
Shangvi wasn't just paying some massive premium in cash. It was a $4 billion total deal value, but that was made up of $3.2 billion in stock and the assumption of $800 million in debt. The exchange ratio was the real key. 0.8 shares of Sun Pharma for every 1 share of Ranbaxy. By executing an all-stock swap, Shangvi brilliantly preserved Sun's cash reserves for the massive, expensive integration process that lay ahead. And Daiichi Sankyo? They were forced to absorb the remaining regulatory downside through their new 9% equity stake in Sun Pharma, and they basically just walked away.
And this brilliantly illustrates the core genius of Dilip Shanghvi's strategy. He completely separated the physical liabilities from the intangible assets. What the market saw were banned factories, incredibly toxic regulatory liabilities, and massive fines. But what Shangvi saw was U.S. distribution scale, the makings of a total dermatology monopoly, and the chance to drastically reduce his competition. He was buying the underlying engine, not the broken factory walls.
Phase 4, buying the hidden assets. Shangvi made it crystal clear to his investors. He was not buying factories. He was buying 4 very distinct hidden assets. Number 1, immense U.S. distribution scale. Number 2, a lucrative dermatology monopoly. Number 3, the immediate end of a brutal price war. And number 4, a massive drug pipeline acquired for literal pennies on the dollar. In essence, he was buying a competitor's obituary and harvesting all the immense value left inside.
Let's look at that first pillar, distribution scale. This $2.2 billion represents the combined pro forma U.S. revenue of Sun and Ranbaxy as of December 2013. Now, Sun Pharma historically lacked really deep relationships with massive U.S. wholesalers and pharmacy chains like CVS and Walgreens. In the consolidated U.S. pharmacy market, generic manufacturers literally live or die by their ability to secure shelf space with these massive group purchasing organizations. Ranbaxy, despite all of its massive flaws, had those entrenched relationships. Shangvi basically bought a massive U.S. sales machine.
Then there's the second pillar, creating a dermatology monopoly. Now, dermatology is incredibly highly prized in pharma. It features much higher margins and significantly lower competitive intensity compared to your standard oral pills. This deal aimed to create one of the absolute leading platforms in the United States. By combining the two companies, Sun became number 1 in generic dermatology and number 3 in branded dermatology in the US. The synergy was just perfect. Sun could simply plug Ranbaxy's highly successful acne drug, Absorica, directly into its existing Taro franchise.
Now for the third and fourth pillars, this is where the competitive strategy just gets brilliant. In the generics market, price erosion is brutal, especially when you have multiple Indian companies bidding for the exact same product. Well, Sun and Ranbaxy overlapped on more than 30 generic products. So by merging, Shangvi effectively killed the price war, removing his biggest price cutter overnight. Furthermore, he scooped up 184 abbreviated new drug applications, or ANDAs. This is so critical because the FDA backlog for approving these applications can literally take years. By acquiring 184 of them instantly, including high-value first-to-file drugs that Daiichi couldn't monetize because of the factory bans, Sun Pharma was effectively buying a time machine for their R&D pipeline, and they got it for pennies on the dollar.
Phase 5, the execution and final payoff.
Let's see how this builds into the classic Sun Pharma integration playbook. The merger legally closed in March 2015, and Shangvi moved completely ruthlessly. Step 1. Close the bad plants. Mohali remained restricted, and plants like Pontasaib and Dewas stayed under import alert for years. He didn't even try to force them back into the U.S. market. Step 2. Fire overhead. They cut over 40% of the sales and administrative overlap and just completely shut down Ranbaxy's headquarters in Gurgaon. Step 3. Shift manufacturing. Shangvi simply took Ranbaxy's valuable U.S. product formulas and moved them to Sun's FDA-clean plants, like the one at Halal. Now, this required securing complex FDA site transfer approvals, which just proves it was a very meticulous regulatory maneuver, not just a simple geographic shift.
And as this aggressive integration really took hold, the narrative in the market totally flipped. Those same financial analysts who previously called the deal crazy were suddenly changing their tune. They started noting that while regulatory overhangs and high fixed costs had obviously depressed Ranbaxy, Sun Pharma was bringing the exact operational strength needed to extract all of that underlying value.
Now, what's really interesting here is the permanent impact of this deal. It is undeniable. Today, when you look at Sun Pharma's current revenue split, a massive 30% of their business comes straight from the U.S. And more importantly,
Their entire powerhouse specialty dermatology business is built directly on the Taro and Ranbaxy distribution muscle that Dilip Shanghvi had the foresight to secure back in 2014.
The final payoff was truly historic. Literally overnight, Sun Pharma became the world's 5th largest generics company and the absolute largest pharmaceutical company in India. They built a total powerhouse specialty dermatology business featuring major brands like Illumia, Cequa, and Winlevi. The grand lesson of this masterclass is just profound. In the generics business, physical factories, they can easily become toxic liabilities. But distribution scale, brand relationships, less competition, those are the real assets. Shanghvi knew that when absolutely nobody else would touch Ranbaxy.
This incredible story forces us to look completely differently at how value is calculated during a crisis. So I want to leave you with this to consider about your own field. In your industry, what obvious liabilities might actually be masking incredibly valuable hidden assets? Thanks for joining me on this explainer, and remember to always keep looking beneath the surface.